We're going to get started. Good morning. We're thrilled to be here at McDonough School, and thank you to everybody who has joined us for this very exciting announcement. My name is Ben Florsheim. I have the honor of serving as mayor of Middletown. And as everybody knows, it's been my first year. So yesterday or Tuesday was the 1-year anniversary of my election, and it's been an unexpectedly challenging year for reasons that everybody is aware of. And a couple of days ago, I got the call that I think many municipal executives have been expecting or receiving, dreading, but expecting. Dr. Connor called me, said we have infections in our high school, we have exposures among faculty and staff, we've got to go full remote for a couple of weeks. And it was a difficult decision to make, but it was also made easy by the fact that we had this amazing partnership with Community Health Center to do testing in our schools. If we had not been doing the testing, the level of testing and the sophistication of the tests that have been made available to our schools, we would not have caught it when it was just a couple of people. We would not have caught it when it was just a few people needing to quarantine. If it had gone another week, we would have had dozens of positive cases, we would have had hundreds of people in quarantine, and we would have been in a really difficult situation instead of the situation that, although we didn't want it to happen, we were prepared for it to happen. And I am so thankful for the leadership of our superintendent, of our commissioner, and of our governor for allowing us to be in the positive place where we are. It's going to be a challenging winter. We know that, but we also know that we are much more knowledgeable, we are much more prepared, and we are much more experienced now with how to contain this virus, especially in school settings, to make sure that our students are still getting the education that they need, that our families are still able to go to work and have some predictability in an unpredictable set of circumstances. And testing is the answer to that. That's what we have been able to provide in partnership with CHC, which we are thrilled in Middletown to call CHC our hometown healthcare provider. But they are also the leader statewide in making sure that this testing is available to all districts. And that's what we're here to talk about today, making this testing available to schools all across Connecticut so that when that call comes anywhere in the state, there is going to be a plan in place. There's going to be quick action to make sure that those students and those families are safe. So I'm really excited to welcome the governor and the commissioner to Middletown to talk about this, and I am really excited. We have had such a great partnership over this year with Dr. Michael Connor, our superintendent of schools. His leadership has been extraordinary throughout this crisis, and I am very excited to turn this over to him. So Dr. Michael Connor.
Thank you, Mayor Florsheim, Governor Lamont, Commissioner Cardona, Board Chair Deborah Kane. Thank you, our partners from CHC that are here today. Yes, last week we did have a shutdown or move to remote strategy for Middletown High School. We had 2 cases where 82 students were quarantined and 21 staff members were quarantined. We would not have known because both of the individuals that did test positive were asymptomatic at the time. However, our testing practices and protocols outline that. And that's simply because of the partnership that we have with the State Department of Education as well as the state of Connecticut, and moreover, Community Health Center as well. Our PCR mobile lab testing, which is conducted every Wednesday for asymptomatic cases, whether it be our families, our students, our staff members, and then the new BinaxNOW Now symptomatic test that gives results, confidential results in 15 minutes, has elevated Middletown Public Schools as well as the Middletown community to a new level. I say that we have a new mechanism within our portfolio of safety measures. So I'm very grateful for this partnership because, again, the strategy is to mitigate the spread. And if we mitigate the spread, we're keeping our community, our students, our staff, our families in a safe and healthy context. So again, I'm very, very appreciative, very humbled that the commissioner, I was in a Board of Education meeting when the commissioner texted me, and he said, do you want to pilot the symptomatic test called BinaxNOW Now, where we can get rapid results in 15 minutes? So I immediately jumped on it and said yes, called my board chair, Mayor Florsheim, and they were in full support of this. So again, very humble for our town, for our public school system, more importantly, very humble for our community members. So without any further ado, I want to welcome our great commissioner, Commissioner Miguel Cardona.
Thank you very much. Good afternoon, and thank you. I want to thank folks from Middletown here, in particular Superintendent Connor and our partners at CHC, who also stepped up and said, we're willing to do what we need to do in Connecticut to make sure that we have testing available for our students and our staff. As you know, we were looking at how to roll out Buy Next Now in a way that's most effective. The goal is to safely keep our schools open, right? And Middletown raised their hand and said, we're willing to do what we need to do to make it happen. So not only do they have Buy Next Now testing available in their schools, thanks to the partnership between Middletown Public Schools and CHC, but also they have PCR testing in a mobile lab. So, you know, this is an example of what districts are doing to evolve to make sure that we can do what we can to keep students in school safely. I commend the district, the board. Thank you for being forward-thinking and for taking advantage of this. I also want to thank Deputy Chief Operating Officer Michelle Gilman, who's really working behind the scenes to make these connections. We have dozens of districts that are interested in hearing more about it. And when we work to find a partner agency like CHC is for Middletown, good things happen. So I want to congratulate Superintendent Connor, the mayor, the board, CHC for their wonderful partnership. And I just want to also say thank you to Governor Lamont for continuously being a champion for Connecticut students. We know the experience that we had in the spring. We learned from that, and we know that giving students opportunities to learn in the classroom is better for them, is better for the community, is better for our state, and he's really led with that, and I appreciate the leadership there, even if it means tough decisions. At the end of the day, we know children learn best in classrooms. The smiles that I've seen when I visited schools and seeing schools function properly and well and make sure they follow those mitigation strategies are allowing those students to have great experiences, not only academically, but also socially and emotionally. We know these kids being around each other is good for them. And I want to thank you, Governor, and it gives me pleasure now to turn it over to our Governor, Ned Lamont.
Hey, well, thank you, Miguel. You're absolutely right. I mean, as I look around the world, I see things flaring up. I see what's going on in Europe right now, which is sort of 3 weeks ahead of us in terms of the flare-up of COVID there. They've made an absolute priority of doing everything they can to keep kids in school safely. And as you've seen, other things have to restrict and close down. They're doing that, making a priority of letting our kids, if they are so inclined, to be able to go into the classroom, be with their friends, be with the teacher, make sure this is not a lost year of education. And as Miguel said, how important it is for these young people in terms of just the social and emotional contact. And that's why we're taking all the precautions we are now more broadly in the economy. And that's why we're doing what we are doing in testing. So, you know, Dr. Connor, you're absolutely right in terms of what we tried to do here. And I'm chairperson in terms of ramp up our testing. Look, in the early days, you said we've got a lot more experience now, Ben, than we did before. That's for sure. You know, back then we could do maybe 10 tests a day. Now we're doing tens of thousands of tests a day. And what makes the testing unique here at McDonough is a couple of things. We do the PCR test wherever we can on a regular basis. It's open to the community as well. And now we have a new test that we've just started distributing. It's called the Binax test. And I just got a little description of it. And let me tell you what makes this so important. With the PCR test, which is, every one of these tests has their advocates, they have their detractors, that I'm learning as best I can. You know, the PCR test, certainly for the asymptomatic and even the symptomatic, is you know, the most exacting test you've got there. And what it does, though, is you get the swab and you send it to a lab, and let's say a day or two later, you get a response back. Well, what do you do at a school like McDonough if a child comes in? Look, if your kid is showing some symptoms, flu-like symptoms, stay home. But what happens if they develop these symptoms while here at school? You know, if you have to just do the PCR test and it takes 2 days to get the results, that can really mean a big quarantine for a period of time. With this Binax test, it's less intrusive. You put it in the credit card size chemical container, and within less than 15 minutes, you get a result. And that result gives the superintendent and the teachers here confidence that if it's a test negative, you don't have to shut down, you don't have to quarantine, you can keep everybody going. Probably it's a good thing to go get a second PCR test just to reconfirm that. But this instant, real-time response is some of the testing we're doing to make it more effective, make it more real-time, allows us to keep our schools open, and allows us to keep our economy open. And the more we test, and we're doing 150,000 tests, the earlier we're able to track this, the more we can contain it. The earlier we're able to track it, you've been in contact with fewer people, it makes the track and trace easier. And here at McDonough School, here on behalf of all the kids, here on behalf of the kids I saw having their music lessons out front, allows them to stay in school as long as we can do it safely. So that's why we really wanted to come and announce this. We've been doing it for a long time, at least over the last month or so at our universities. And this is going to be our first K through 12, and I hope what a difference it makes in allowing us to keep our schools open safely. Thank you, everybody.
Thank you, Governor. I want to also take a moment to acknowledge and ask representative from the Community Health Center who also raised their hand and said, what can we do? Yvette Highsmith is here to talk a little bit about the CHC's role in this process. Yvette?
Thank you, Commissioner, and I'm hesitant to take my mask off, so you're going to have me talk with my mask on. I'm Yvette Highsmith-Francis, Regional Vice President with the Community Health Center, Inc. We are a statewide federally qualified health center and provide health services to thousands of children across the state where they spend most of their time in schools. So we were delighted to partner with the Governor's Office, the Commissioner's Office, and Middletown's Public School District to offer this testing, comprehensive testing, to Middletown's students as well as the faculty and employees of the school district. And so we continue to be an engaged partner, are excited. We have our team here, our nurse practitioner and medical assistant that work in the school on a regular basis. And we know, we hear from the students that this is where they want to be. So we want to be a part of that solution in ensuring that we stop the spread and that we provide the resource to the district to be able to keep the schools open. So we are, along with the other federally qualified health centers across the state, I think engaged, happy to work with Michelle Gilman and the Governor's Office and other school districts to continue to provide access to this important resource. Thank you.
Is the test fairly easy to administer? Was there any training that has to be done in the schools?
Great question, and so yes, it is a test. It is a CLIA wave test. It does require that the nurse practitioners that administer it be competencied, and so we as an organization have an internal process for that. The Department of Public Health also offered several testing sessions, training sessions around the test protocol.
How many tests will be made available to the Middletown School District through this pilot program? How many tests do you anticipate doing on a regular weekly basis?
So hard to anticipate. To be honest with you, I tend to land on the optimistic side, and my staff will tell you, I said, oh, don't worry, we're not going to do very many of those. But to date, we've administered about 10, and we have a large amount of tests available to the state of Connecticut through the federal government.
I just add that we've gotten about 150,000 tests to date. We've distributed about half of those, like I said, primarily at universities right now. And the federal government said we're going to have 1 million tests available before the end of this year.
And that's of the specific.
Of the Binax real-time tests.
And how many students are in the Middletown School District?
About 4,400, and at our mobile PCR testing lab that we have in partnership, there was an increase of 13%. As of yesterday, we've only been doing this for 2 weeks. There was 217 PCR tests that were administered yesterday, so we're seeing an increase with people getting tested in the community.
And are the infections at all the schools, I mean, elementary, middle, or high?
It varies. It varies. Again, this is a 1-week-old initiative. Last week, as you saw, with the The residual effect that we had with Middletown High School, again, that was purely from last week's test that was administered on Wednesday to the student as well as the teacher. So again, you know, as we test more, as we increase more, we're probably going to see more positive cases. That might be the natural impact or effect of it, but again, it gives the mayor and myself more strategy on how we be able to mitigate that, especially within all of our schools.
Governor, another logistic question. So how many tests will be administered specifically to Middletown Public Schools?
Maybe somebody can answer that better than I can.
So if a student or staff, if they're showing symptoms, then they would be able to have the Binax Now test available to them at their schools. But on Wednesdays is our PCR mobile lab testing, which if they choose to with their family, they'll be able to get tested. But we also have testing available, both symptomatic and asymptomatic testing at CHC. So we're working in partnership and conjunction to have it at various sites within our neighborhoods or our districts within Middletown. And then also there's testing available at all times with CHC.
And Governor, are there enough of the Binax test to administer to all of the schools that want to have a rapid test like this?
I think so. We got to see what the supply is as it comes in. As you probably know, the colleges are going to be winding down come Thanksgiving vacation, and so I think we will have additional Binax testing as well. And it's just worth noting that one of the safest places to be in the state of Connecticut in this COVID world is at an elementary school in Connecticut. The kids are wearing the mask, the protocols are very strict, the infection rate is much lower than it is in the general population, and this testing is one way to continue that.
And is the batch, the 150,000, that's what's being used with the schools right now?
Yes, yeah, that's right, Sue.
Governor or Commissioner, we had a lot of people on, listening on Facebook, like Facebook Live and whatnot. Do we have a future timeline? I mean, obviously you're pleased with what's happening here in Middletown. Do we see this rolling out to schools soon? Thank you.
Sure, thank you. So, as Dr. Connor mentioned, he was in the middle of a board meeting, and I think he was whispering, "I'll call you back." And a week later, we're here. So he raised his hand. He got the partners together. Clearly, there's a good partnership already established here in Middletown. I can tell you we have at least 15, 20 other districts that are working on those details right now with Community Health Center, as I said, stepped up, but there are other providers, and they're working out some of those logistics like the CLIA waiver and, the training to make sure that, everyone has a consistent training. There is interest. I'm pleased to see that. And I think everyone recognizes that, we have an opportunity to do our part to make sure that we have the testing available. We're fortunate that, as the governor said, the schools are not being, we haven't seen widespread transmission in schools. We're seeing it in the community. So when we have the opportunity to identify students who have symptoms with a Binax Now, it helps reduce spread in the community as well, because those students are finding out there. So I think this is a strategy not only to help keep schools functioning, but also to lower the spread in the community, which is critically important.
And unions, when school was opening, over the summer, they were begging for testing.
Yeah.
Was this the fact of not having it available, or is hindsight 50-50 and they're going, should I have to roll that?
No, not at all. I think, as the governor mentioned, we were testing 10 a day. The testing capacity in Connecticut, I think, rivals any other state. I think, we've been fortunate in Connecticut to have testing available. This is just another layer. This is another tool in the toolbox here in Middletown to give students and educators that opportunity. And you're absolutely right. The educators that I've been meeting with regularly are thrilled that this is an option that's available, and they recognize the importance in order to keep schools open to have this option available.
And folks haven't heard about this, just cost. Who's paying for this?
Mm-hmm. So the federal government is providing it, and CHC is administering the test in part of their partnership.
Does it weigh on Middletown? Are you guys, is this hurting your budget? Or do you have any more costs because of it?
No, the state of Connecticut, as well as the State Department of Education, is supporting us with this as well. So this isn't touching our operating budget or any grants as well. I don't know the logistics around insurance and all of that, but obviously this is an initiative supported by the State Department of Education and the State of Connecticut.
The students don't need to have insurance necessarily to get it. It's available for anyone.
And they just fill out a simple form and they get tested.
Superintendent, when we talked last Wednesday, I know there hadn't been any of the Binax tests, rapid tests, administered since then, have there been, and do we have results as to how many positives or negatives from that test?
I believe the numbers are low. 10, am I correct? Yes, 10. We've had 10 administered within the district.
And have they been positive?
2 positives.
And but the two that had shut the school down, that wasn't from the Binax, that was from the drive-through?
Correct.
And Commissioner, you mentioned that 15 to 20 other districts are interested. Any idea on the timeline for when others might start onboarding? We talking a couple days, couple weeks?
Sure. So, Deputy Chief Operating Officer Michelle Gilman has really been instrumental in this work. So she's working with those districts to try to get a quicker rollout. I don't know if you want to comment on that, but I do know that she's doing the work, and we're hoping that within the next week or two we can start bringing other districts on and give those districts that opportunity. Did you want to comment on that?
Just to really echo what the commissioner has said, there are other districts that are in early stages of conversations. We really viewed Middletown as the pilot of a pilot and thought that this would be a great opportunity to really identify the workflow, to figure out how to do it, and then spread it efficiently and effectively to other districts across the state.
And Commissioner, there's been an increase in homeschooling over the past year. It went from 547 exits last year, now this year is about 3,500. Is there any concern going forward, or can you just talk about that?
Thank you for bringing that up. You know, we worked hard, and I want to acknowledge the districts and the performance office for really setting up a system that never existed before. We never tracked data the way we're doing it now, and that's basically us saying, what are the issues, how can we address them? So we have the data, we presented the data yesterday. I'm really ready to roll up our sleeves now and say, how can we close some of these gaps that were exacerbated? In terms of homeschooling, you know, the best way to get students to re-enter our schools is to provide programs like this where we can build that consumer confidence in public education and make sure that parents see that their children can get a good learning experience in the school systems, and that the school systems are paying attention and keeping health and safety first. The number did go to 3,000, and that's higher than it was last year, obviously. But I think, you know, a lot of parents made decisions in the fall. They were not sure what to expect. We found that in pre-K and K, a lot of parents chose to also keep their children home another year. So we are, diving into that data and trying to find ways to make sure that we can provide opportunities for all students in Connecticut.
So sensing less concern and more now actionable because you have the data.
It's, you know, we wondered why are we seeing a decrease? So now we know, and now we can work on strategies to try to communicate what we're doing in our schools to build that consumer confidence that's critically important in public education. Thank you.
Commissioner, it sounds like the Binax sound test has a higher margin of error than the PCR test. Do we know how much higher?
So I don't have any information on that. I don't know if you want to speak to that.
So not different test. So the PCR test is the gold standard, and you can test symptomatic or asymptomatic and have high confidence in the results from the PCR. The Binax now, the efficacy is for symptomatic individuals. So if you get a negative result from the Binax now, you should get the PCR just to confirm the negative result. If you are positive on the Binax, you are positive. It is only testing for the coronavirus.
Is the PCR the 5-day?
So not 5 days, 2 to 3, you should have your results back. It does have to be processed by a lab, and really depending on who the laboratory partner is, it could be a shorter time frame than that.
And can you go over the steps? Okay, somebody shows up at school, they're not feeling well, test is administered, it comes back positive. What then happens?
So if it is a student, that parent has been called by the school nurse because their child presents as being sick and probably needs to go home. And when the parent arrives for that child, they give consent to have that test done if they would like to, if they'd like to have the test done. And at that point, if it's positive, we follow the state protocols from the Center for Disease Control around quarantining. So that child needs to go home. If that parent or guardian also wants to be tested, we can administer the Binax now to that individual as well, again, because we are trying to contain the spread. So we want to know the status of as many people in that family unit as possible. And for employees, we're using the school nurse as really our gatekeeper for accessing the test, identifying if someone is sick in the building and needs to have access to it. That individual gives consent to the test, it's administered, and then they follow the same measures around quarantining.
And should there be any follow-up PCR test? Is that just on a patient-by-patient basis?
If you get a negative result, you should get a PCR. We do make that recommendation. If your Binax Now test result is negative, you should go get a PCR. Here in Middletown, we at the Community Health Center offer that drive-up, walk-up testing daily, 7 days a week now. So you can certainly go right there and get that PCR test done. And there are a host of other places in the community across the state you can get the PCR as well.
And what about the tested positive? Should they do that as well?
No. So if you get a positive on the Binax, you're positive and you have COVID-19 and you should quarantine.
And with the Binax test, is that, obviously there's a partnership with the health center in Middletown, but is that something that schools could do on their own with the on-site staff, or do they have to be partnered with the health center?
So you don't have to be partnered with the health center. I think, so there is a competency level for administering the test. So school faculty would need to be competencied around doing that. And, there's some complicated logistics around that. I think that, the commissioner and the governor's office would need to walk through those logistics.
So as I mentioned earlier, CHC said, hey, we're ready to go. And we're working out, it's a pilot of a pilot, right? So we're working out those logistics with the partners. Another thing that I know Middletown has done really well is communicate to families, if you're not feeling well, stay home. If children are in school and then they start not feeling well and the parent chooses, that's fine. But there are so many options in Middletown to get tested. We're encouraging families, if your child's not feeling well, or a staff member, if you're not feeling well, stay home, and then work out arrangements to get the Binax Now or the PCR test. Certainly, one of the best strategies for mitigating spread is, if you're not feeling well, stay home. And that's the message that Middletown is sending, and that we're sending throughout Connecticut in our schools especially.
I guess what I'm asking is, with the districts that are still working on getting onboarded and are interested,
Right.
Are they all going to be partnered with some type of health center?
Yeah, the primary strategy is really partnering with not necessarily a health center, although the community health center has many different sites and they're stepping up in many different communities, with a testing partner. And in some cases, the testing partner might be a local entity or a private practice, and they're working out the details there on that. Yeah.
It has to be a medical provider?
I'm sorry, yes, yeah, it's somebody that.
I think we unfortunately do have to wrap this up. I want to thank everybody for being here. I want to thank McDonough School, our wonderful neighborhood school, and our principal, Davian Reardon, for hosting us, and Governor, Commissioner, Dr. Connor. This is a really extraordinary partnership, and we're excited that Middletown is leading the way in partnership with Community Health Center, and we're excited to see what comes next. So thank you very much, everybody.
All right.